For millions across England, NHS dentistry has now effectively ceased to exist. Shocking new findings by the British Dental Association from new official data has found unmet need for NHS dental care in England has hit an all-time high. 13 million people, well over 1 in 4 adults, are now struggling to access dental care. Just think about that, 13 million. For millions, the appalling findings will come as no surprise.
Hundreds queued in Bristol today to get registered with an NHS dentist. Some brought blankets to keep warm as they waited for hours to sign up for the new practice.
It's a major crisis, but there's been long enough that crisis has been known about for it to never get to this stage.
I've been looking since I got dumped by my old dentist, and I haven't been able to find anyone that's not private.
We get a lot of people in the pharmacy queues. What's the best thing for toothache? I can't get a dental appointment. Over and over and over again.
The BDA's shocking new analysis is a rise from the 12 million we saw last year, and light years from the 4 million that was the norm pre-COVID. NHS dentistry was a top issue on the doorstep during the election campaign, with people now forced to pull out their own teeth with pliers and many driving hundreds of miles for treatment. If they can find a dentist at all, it's not exactly surprising.
2 years ago, I raised the case of a Norwich Army veteran. In such agony, he was forced to pull out 18 of his own teeth because he couldn't get access to a dentist.
The BDA's analysis of the recently published GP survey by Ipsos shows an estimated 5.6 million adults tried and failed to secure an appointment in the last 2 years. Nearly as many have given up even trying, with 5.4 million not even attempting to make an appointment as they didn't think they could secure care. Well over 1 million have been put off by the cost of NHS treatment, and over 750,000 are on waiting lists.
In Bristol on Monday, there was scenes of a line forming all the way around building for people desperate to get an NHS appointment in a practice that had opened. And within 2 hours of opening, police had to be called to control the line.
And these new figures are just for adults. Not only are people being forced to pull out their own teeth at home because they can't access or afford an NHS dentist, more than 100,000 children have been hospitalised since 2018 for rotting teeth.
In Wolverhampton, they have the highest rate of tooth decay in children in the country, and someone who's seen the worst of it is Neil Barcher. You've been working here in the area for 16 years.
That's right. The situation is that we've got an unworkable dental contract which actually penalises dentists for spending more time with clients and patients, and as a result what we've got in Wolverhampton is some of the largest amounts of dental tooth decay, and I've seen it firsthand and it's horrible to see. And what we have now is a situation where those in most need of dental care, those poor children, are actually the least likely to receive it.
It's absolutely shocking. Tooth decay remains the #1 reason for hospital admissions amongst young children. And research in the British Medical Journal this week shows children in our most deprived communities are now 3 times more likely to need their teeth removed. Just think about that. This is a wholly preventable disease, but decay and deprivation go hand in hand. And the simple fact is the reason for the disaster we're seeing unfold in UK dentistry is more than a decade of Tory austerity and the savage slashing of NHS dental services in real terms since 2010 by the previous Conservative governments. It's a stark reminder of the challenge ahead. Now, the new government has done the right thing by accepting the NHS, and dentistry itself is broken. So at least we're not seeing the denials we saw from the last government. Ministers have finally accepted we have a problem, and that's at least a start. Now, the British Dental Association is calling on the new government to offer a rescue plan to keep struggling practices in the NHS and show there's at least light at the end of the tunnel. And rapid action is needed. Labour pledged in their manifesto to reform the discredited contract dentists work to, a system that's fueled an exodus from the NHS workforce. So the new government must now move at pace and with urgency if NHS dentistry is going to have a future.